Hi guys, here's Paula, the crazy ozone lady, with another edition of the Ozone News. I think this is episode number 7, and I will be talking about articles and news from the world of ozone therapy, but also hyperbaric oxygen and just in general oxygen, oxidative, and ozone world. Before we begin, make sure to subscribe to my newsletter. So go to thepowerofozone.com/news, type in your email address, and you will receive all my uncensored thought crimes directly into your email box. Talking about censored or uncensored. So when if you're watching this on YouTube, then you will be watching the censored version. If you want to watch the uncensored, complete, original version, then you need to go to Odyssey. And for this, you will need to go into the description of this video and click on the link that will direct you to the uncensored video. And the reason why I have to do this is because some of the news stories are about studies which have been performed on the novel, virus that shall remain a thought crime. And so they have performed studies on this with ozone therapy, and of course you are not allowed to talk about this unless you are on alternative media. Then you can talk about this. So let's begin with the first story. The first one is that there is a new FDA approved SuperSaturation technology which is used on heart attack patients. And here Avita Health System, which is the first healthcare organization in North Central Ohio and the first critical access hospital in the United States to improve the treatment of severe heart attack patients with supersaturated oxygen SSO2 therapy, the first and only FDA-approved therapy that immediately follows angioplasty and stenting to significantly reduce heart muscle damage. And you hear doctors with this machine which delivers this supersaturated oxygen therapy. And so how exactly this works, you can find it explained on the company's website. So Zoll here, this is the company which produces this technology, and you see they have here this graph that explains how it works. So basically, blood is flowing from the patient. You see here arrow, patient's blood, into this machine, and there is an oxygen tank attached to the machine. So the machine then delivers oxygen into the blood, and then the super oxygenated blood, which is then bright red, is being reinfused back into the patient, but not via a vein, but via an artery. And here it is described again. So it's SSO2 therapy is a localized hyperoxemic oxygen infusion. Hyperoxemic, this means that it is supersaturated oxygen. So this is above normal oxygen levels. If it was hyperoxemic, then it would be a lack of oxygen. Hyperoxemic means supersaturated, so more oxygen than above normal oxygen levels. For the coronary arteries following a heart attack, SSO2 therapy is a one-time 60-minute infusion of superoxygenated blood delivered via a catheter to the left main coronary artery. The superoxygenated infusion is delivered with an elevated PO2 content 7 to 10 times higher than normal arterial blood. So this is for patients, to make this clear. So this is for patients who had a heart attack. So this is not to prevent a heart attack. This is for patients after they had a heart attack and after they had surgery or after they had a stent put in place into the heart. So this is basically to prevent further damage, tissue damage, and to treat the necrotic tissue. And here you see here on those pictures, it says here O2 diffuses into tissue, stopping necrosis. Necrosis is dead tissue. And they show it here, how the superoxygenated blood basically helps to restore the muscles which were damaged because they did not receive enough oxygen. So this technology tries to reverse this muscle damage, because the heart, as we know, is basically a muscle. So yes, this is FDA approved. Now, of course, anyone who knows about ozone therapy knows that this sounds very similar to what you receive when you go for intravenous ozone treatments. So it's very much possible that you could have the same effect, maybe possibly even better, simply by going to your doctor and by getting a major autohemotherapy or a TAN pass or a direct intravenous oxygen treatment, because this would also supply some extra oxygen into your blood circulation. The difference here is that this superoxygenated blood is reinfused into the artery, not into the vein. With ozone therapy, it goes into the vein, but it's very much possible that the effect would be either similar or possibly even better. We don't know, but for sure it would be cheaper, I can imagine. All right, next story is South African ozone sterilization technology is becoming more and more popular in South Africa and around the world. So there is this company, Arc Aqua, at Cape Town. Cape Town is a city in South Africa. A Cape Town-based company has patented technology that allows ozone to be entrained within a shroud of water droplets, directing the ozone to the exact point of sanitization. And this is used on citrus fruits, but also stone fruits, but also fish, poultry, and other meat products. And so here it's explained, the ozone sanitizes the surface, removing bacteria and mold while enhancing the overall shelf life of the product and contributing to the effectiveness of the fungicides added afterwards, Crispin says. Crispin, I believe, is a representative of this company. So basically the ozone, which is mixed in a shroud of water, is used to prolong the shelf life of fruits and other foodstuffs. So it's used on stone fruit, mangoes, and papayas and pomegranates. So I'm not sure what they mean with stone fruit, but I think stone fruit typically it's stuff like peaches and apricots, nectarines, possibly avocado, because I think avocado is officially, botanically speaking, I think it is a fruit. So, and they have installations in Israel, in a number of South American countries, but also in California. And they say that it's becoming more popular, especially during COVID times. And he says he estimates the current ozone usage in the South African citrus industry at 15 to 20% at the least. This is not bad. So this is not some fringe, unusual, strange technology. 15 to 20%. This is up to 1/5 of the citrus fruit markets, the citrus fruits packing market. This is a significant amount of the market. And they say Arc Aqua has developed these ozone sanitation systems in various other industries like fish, poultry, and dairy with equal success. Now, this is really interesting to me because I have read a number of studies, and those studies came actually to the conclusion that when ozone is used in meat processing, so when meat or fish is being ozonated or is being treated in ozonated water, that some unusual and potentially problematic byproducts are being produced. So either they have here found a way around it, or maybe there are other scientific findings which contradict this. We don't know. But anyways, it definitely works on citrus fruits and other stone fruits, mangoes and such. So this is exciting. This is interesting. Okay, another exciting news has nothing to do with, well, indirectly it has to do with ozone, but in this case more oxygen. So some of you may know NeoMed Institute in Cyprus. So this is an ozone institute, an ozone wellness place. So some people go there for like a month-long ozone program. And so now this institute has a new toy. They have a bubble bath with nanovated oxygen. So the way it works is it generates negatively charged oxygen bubbles that are 100 times smaller than human pores, making them capable of entering the body. The nanobath system produces billions of bubbles that deliver therapeutic levels of oxygen into the bathing water. The oxygen-loaded microbubbles help the skin to regenerate by penetrating pores and washing away waste products to enable cells to absorb the maximum amount of oxygen possible, thereby enhancing metabolic health and growth and encouraging the release of toxins. These miniature gas bubbles measuring less than 50 microns, 0.002 inches in diameter, are filled not only with oxygen but also nitrogen and other gases. Due to their size, they hang in the water to form a cloud around the bather. Right, so the way it works is that the water basically becomes milky. So it's not translucent anymore, but it just looks like a milky like a milky cloud. And this really seems to work. So they say that there is increased research into the benefits from Oxford Institute and some other institute in Japan. They say that studies have looked into the specific health benefits from cosmetic to therapeutic purposes. And so it's been found that what you can achieve with this is reduction of refractory dermatitis, atopic dermatitis, and psoriasis vulgaris, increased metabolism and energy levels, better sleep quality, softer skin, increased and lasting blood oxygen levels. Lasting blood oxygen levels, okay, that's interesting. Decreased inflammation and pain, skin rejuvenation, muscle relaxation. So I do know that this definitely helps for dermatitis and psoriasis. I've seen pictures, before and after pictures of one child, or was it maybe even two children, who had a dermatitis or some type of an eczema, some type of a skin condition, and then they did those baths with those nanobubbles and the skin condition improved dramatically. So this is interesting, and it sounds like a kind of like a pleasant treatment. All right, the next story is, it's not a good story. This is again here, ozone therapy under attack. So in Medical Dialogues, an article is telling us that ozone therapy can be harmful and it can cause ozone-induced encephalopathy, a harmful result of ozone therapy. And so what this is they're saying that a recent study published in the European Journal of Neurology, and the study has been conducted in Italy. So really it's not a study, it's a case report of 3 patients who underwent ozone therapy and developed neurologic symptoms including cortical blindness, altered awareness, headache, amnesia, and behavioral changes. Now those are very serious neurological changes, but what they do tell us is that the condition of all 3 patients improved within 48 hours. They later say that actually all of those symptoms were completely eliminated after 48 hours. Nevertheless, the people who conducted this report, who wrote this report, so those Italian researchers and colleagues, they say that what they wanted to do is to attempt to raise awareness about neurologic complications associated with ozone therapy. owing to the increased use of this therapy. Now, I would be fine with this if this is what they really wanted to do. If they just wanted to raise awareness about complications, this would be fine, because I think this serves everyone, serves the patients and the doctors to be aware of possible complications and to have a realistic image of what ozone therapy can do, both the good and the bad. But they seem to have quite a bias, because I do not think that this is what they wanted to do. I don't think that they just wanted to raise awareness. No, they wanted to raise alarmism, because they say the researchers supported a statement from the US Food and Drug Administration about ozone being a toxic gas with no known useful medical application. Now, this is really interesting for a number of reasons, because Italy has their own equivalent of the FDA. So why is it not that they are following their own local administration, their own local authorities? Why do they have to cite the US authorities, although the researchers are in Italy and they are talking about cases which happened in Italy? So, but here's the thing. So this is really a textbook example of how to create bias in people who read such articles, because this is completely biased, what they're saying. But I'm going to go into this, but first let's look at what exactly happened. So first of all, what people need to know is that the type of ozone therapy that was administered here, those were injections into the cervical spine. All right, so those were cervical ozone therapy session for chronic neck pain. All right, so here, so I actually read the whole paper. They have here only the article. I read the whole paper. So this is a treatment which is very invasive. Some of those types of injections, they require image guiding technology. So basically, the neck is constantly under X-ray machinery, so that the doctor can trace through the X-ray exactly how he places the needle. So this really requires some precision work, and this is outside of Italy. This is something that is not performed very often. So this is not intravenous ozone therapy. This is not what you will receive when you go to your doctor in the US or in most other countries for some chronic infection or to boost your immune system. So this is something that is very, very specialized, okay? Number one. Number two, again, I'm stressing that the patients recovered completely. Yet, still, it is good to know that such complications can happen. And by the way, so for those people who are asking me, well, how come you, Paula, who have neck problems, which is true, I have neck problems, cervical neck problems myself, how come you don't get some ozone injected into your neck? Because of such cases, because I know of such cases. Those are not the first such cases that have been reported. There are more. And then the authors say that in addition to the three cases that they are encountered, they have found 8 others in literature, which I have been aware of for quite some time. So, but here's the thing. So here's the manipulation, the emotional manipulation that happens here, because they are just presenting us those 3 cases where some troubling side effects happened, but they do not tell us those were 3 cases out of how many. We don't know how many are performed every year in Italy. I mean, it is a difference if in total in Italy 1 million such ozone treatments were performed, and only 3 known have experienced adverse effects, or if it was 3 out of 10, let's say. So they don't tell us. So this is first important points, and this is one way how you manipulate people, how you brainwash people through omission. You omit a context. You omit the complete picture that is missing here. Another thing is that they also don't tell us what is the conventional treatment. So if they had not done ozone therapy, what was the alternative option for them? If those patients had gone to conventional doctors, what would the conventional doctors had proposed? Would it have been surgery? Would it have been injections with dextrose, or injections with an anesthetic, or some other conventional treatment? And so it would be interesting to know, okay, what are the risks with this conventional treatment? How many people who, instead of getting ozone therapy, do surgery, for example, for those types of neck problems? And how many of those people who have neck surgery experience symptoms like cortical blindness, altered awareness, headache, amnesia, and behavioral changes? Now, this would be relevant to know, because it is possible that the conventional treatment, so the conventional alternative, is actually much more riskier than ozone therapy. So this is another important fact that is not mentioned here, and that is again omitted. So this is another way to paint ozone therapy as something dangerous, right? So this is again manipulation, emotional manipulation through omission of context, omission of data. Another point is, we don't know whether the patients who are presented here, maybe they already tried all other possible routes, and maybe ozone therapy was presented to them as the only option left. And so in that case, they were willing to risk really anything, right? We also don't know this because this is omitted here in the report. But those are all important points, and really without knowing this, you cannot come to the conclusion that ozone is a toxic gas with no known useful medical application. Okay, this is another point. Okay, in order to come to this conclusion that ozone has no known useful medical application, they would have to actually look at the entirety of patients who have received those types of ozone treatments. Okay, so if they say there's no known useful medical application, are they saying that no patient ever improved after such ozone treatments? Like zero? They didn't find a single patient who has improved after ozone therapy? I mean, this is unlikely, because there are many stories, anecdotal stories, and also studies which paint exactly the opposite picture. So this is manipulation. This is very deceiving, right? You cannot make such a statement unless you have actually looked at other cases. You cannot conclude from just 3 cases and say there's no benefit to it, whatever, when there are thousands of patients who receive ozone treatments every year, and a considerable amount of them actually derive benefit. Even, let's say, hypothetically speaking, let's say that just a small percentage, maybe just 10% of all people who do ozone therapy derived benefits. Okay, this would be very small, and the number is probably exactly reversed. It's probably more like 90% of people who do ozone therapy derive some benefit. But let's, hypothetically speaking, if that was true, all right, then you still could not make such a statement that ozone has no known useful medical applications. So this is another way to raise alarmism and to brainwash people and to make them afraid of a natural treatment, which is one of the safest ever invented. And again, those 3 patients recovered after 48 hours. Their symptoms were completely gone after 48 hours. Another story, this time change of topic a little bit, hyperbaric oxygen chambers. So this is reported by MSN, and this is a story of a music professor who lost his hearing. This is a short video of less than 2 minutes. He says that he suddenly lost his hearing, but then he did hyperbaric oxygen treatments. I think he received 20 of them, and now his hearing is restored by 99%. So I'm sure he is quite happy about it. Being a music professor, being able to hear is quite important. Another story where hyperbaric oxygen therapy has been in the news and is used again by sort of celebrities. This is Ryan Sutter. I've never heard of him. He's a Bachelor star. He has some mystery illness and he's been doing hyperbaric oxygen therapy. Here's a picture of him inside a hyperbaric oxygen chamber. But unfortunately, it does not seem to be helping. So he says it's been 5 months now, and if anything, I feel worse. Though I am functional and continue to work my regular fire schedule, I'm experiencing a battery of symptoms, which include, and I think here this is also the key to understanding why he's not improving, because the symptoms that he's describing here, in my opinion, allow for the conclusion that his problems may be of structural nature. So he says he suffers from fatigue, sometimes almost paralyzing, deep body and muscle aches, fevers, night sweats, full body itching with no rash, headaches, neck and throat swelling, congestion, lightheadedness, nausea, and just general all around not feeling good. So this could be some structural problems also, because he reported that the way the problem started was after a very intensive training for the fire department. And this is often how structural problems come to the fore, is that people overwork themselves or overexert and do some kind of physical exertion that changes something in the spine, and then they have a sudden onset of very troubling symptoms. So this could be an explanation. But what is interesting that this is kind of mainstream publication. This is People magazine. So this kind of takes away from the stigma of oxygen therapies. The more stories we hear about celebrities using those types of alternative treatments. Now, there's another success story that I can report. This is something that will be uploaded soon on my channel. This is a friend. We'll be talking about him, about his story. He had a very, very bad bladder infection, and it was so bad he tried everything. He tried antibiotics. He tried drinking ozonated water. He tried ozone saunas. Nothing helped. It was so bad, he got so sick that he lost his job over it. And then he did a ozone bladder insufflation, and that fixed the problem. So this is an upcoming story, so I just wanted to give you a quick scoop. So look out for that story in the near future. So some more news is that PromoLife has something new up. They always come with some new stuff. They're such an inventive company. It's really, really interesting. So they have now this O2 empty oxygen nitrogen high altitude training system. And so I received this email in my inbox, and this is really interesting. So the way it works is that basically you breathe either a very high concentration of oxygen, so around 95%, and then it's alternated by a hypoxic treatment. So then you breathe 14% of oxygen. So the normal oxygen level to breathe is 20%. Okay. Now 14%. This is 14%. This is well below the 20. And so how this works, or why this is supposed to be beneficial, is explained here. So this accomplishes two important benefits that standard EWOT stands for exercising with ozone therapy, will not. The first is that by switching to hypoxic, low oxygen environments, so this will be those 14% levels, your circulatory and respiratory systems are forced to work harder, and this allows deep absorption and penetration throughout the body. The second important benefit is that by switching back to the high oxygen reservoir, you will rapidly speed up the oxygen absorption rate and increase the solubility of oxygen into the blood. Interesting. So first you force your body to work harder by breathing not enough oxygen, and then you supply a extra oxygen by breathing 95%. So this is really interesting. So this is a new gadget. In case you're interested in this, you will find a link below the description of this video. And another news from PromoLife, they have EWOT back in stock. So for a while this was out of stock and now it's back on stock. So this is EWOT, this is exercising with ozone, with oxygen therapy. So basically you are breathing high percentage of oxygen, again 90-95% at a high flow. So between the oxygen concentrator that is used with it has to produce either 10 liters per minute or 5 liters per minute. And this is filled here into this bag and you breathe from this bag, from what I understand. I've never tried this, okay, so I cannot comment on it, but I know that it's quite popular. And this is something that is recommended by a number of ozone and oxygen experts. So you are on a bicycle, so you're training at the same time you're breathing oxygen of very high concentration. All right, so this was it. This was it for this edition. Make sure to subscribe to my newsletter, thepowerofozone.com news, and you will be notified about my upcoming book the minute it comes out. So thank you very much for watching. Nothing that I said here in this video was meant as medical advice. If you have questions, comments, write them below the video. Thank you very much for tuning in and see you soon. Bye-bye.